Welcome back to The Explainer. Today, we're tearing right into a highly specific, breaking headline straight from the pharmaceutical business world. We're going to break down the anatomy of a potential mega deal. We're talking about who the players are, what they actually want, and exactly how high-level finance ripples all the way down to the products sitting in your own medicine cabinet. If you love understanding the hidden, everyday mechanics of the healthcare market, well, you are in exactly the right place. Okay, let's dive into this. Our source text today is a simple, direct headline. Private equity firm Creador in talks to buy into generic drug co. Leeford Health. Now, on the surface, sure, it reads like pretty standard financial news. It's just a single sentence detailing an ongoing negotiation. But packed right there within those 14 words is a really fascinating collision of two completely different industries. You've got this massive pool of investment capital looking for a home, meeting the actual company that manufactures the pills sitting in your bathroom cabinet right now. Which brings us to the core question of today's explainer. Why is private equity eyeing your medicine cabinet? I mean, it can be pretty jarring to connect the abstract, hyper-competitive world of high finance with the grounded, everyday reality of the healthcare products we all use. The stuff we use to get over a cold, manage blood pressure, or just keep our families healthy. But the truth is, these two worlds are deeply, deeply intertwined. So to truly understand why a massive investment firm wants a piece of a generic drug company, we need to take a structured look at both sides of the negotiating table. All right, Section 1, meet the buyer, Creador. Now, the headline identified Creador as a private equity firm. And we know their playbook, right? They aren't just looking to hold assets passively. No way. They act much more like corporate architects. They pool capital to take significant stakes in companies that have really strong potential, with the ultimate goal of optimizing operations and eventually realizing a massive return. Their motivation here is purely financial. They're looking for a highly profitable, scalable, and resilient place to park their capital and literally watch it multiply. Moving across the table to Section 2. The target, Leeford Health. Leeford Health is a generic drug company. You know how it works. Once a famous, highly expensive pharmaceutical loses its patent protection, generic manufacturers step right in. Leeford's core business is mass-producing these essential, highly regulated, and incredibly widely consumed medicines at a massive scale. They essentially represent the high-volume engine of accessible healthcare. They supply a steady, reliable stream of affordable, identical quality alternatives to those pricey brand-name formulas. And this brilliantly illustrates the whole dynamic at play here. On one hand, we have Creador. They are the financial buyer, hunting for rapid growth, optimized operations, and maximum ROI. On the other hand, we have Leeford Health, the healthcare producer, absolutely laser-focused on manufacturing essential medicines and navigating incredibly strict health regulations. It's the aggressive, fast-paced momentum of private equity meeting the steady, absolutely crucial output of generic pharmaceuticals. Which brings us to Section 3, the generic drug factor. So the crucial point is that generics drug companies possess very specific strategic advantages that make them incredibly attractive targets. Just think about these factors for a second. You have incredibly high consumer demand, massively established distribution networks, and an inherent ability to instantly capture market share post-patent expiration. But most importantly, these are essential, non-discretionary goods. I mean, you might skip buying a new TV during a recession, but you definitely won't skip your heart medication. For a private equity firm, this spells absolutely unmatched financial stability and massive growth potential. Let's bring it all together in Section 4, why this deal matters. Let's move to and see how this builds step by step into a functioning corporate courtship. Let's literally map out the anatomy of the deal. In Step 1, the private equity firm, Creador, targets healthcare stability for its portfolio. In Step 2, Leeford Health enters the picture, providing an already established portfolio of essential generic drugs. This perfect alignment leads directly to Step 3, where talks officially commence. Capital is going to be exchanged for a powerful stake in the company, Creador gets their robust, recession-proof investment vehicle, and Leeford gets a massive influx of cash. Cash they can use to potentially expand their operations, research new generics, or even dominate entirely new markets. As we wrap up this explainer, I want to leave you with this final, provocative thought. We've seen the logic behind the headlines today, but we really have to ask ourselves, what actually happens when high finance directly shapes the companies stocking our medicine cabinets? Does a massive influx of private equity capital mean we're going to get better, cheaper generics faster? Or does that relentless push for investor returns fundamentally change the way these essential companies operate? It's a truly fascinating dynamic. And as these talks between Creador and Leeford Health continue to unfold, we are definitely going to be watching closely to see how it reshapes the everyday reality of our healthcare. Thanks so much for joining me for this deep dive, and I highly encourage you to keep questioning the business behind the products you use every single day.